Let us discuss about Dermatitis Herpetiformis. Dermatitis Herpetiformis. Okay, this Dermatitis Herpetiformis is also called Darling's disease. Darling's Darling's disease. Okay, it is also called Darling's disease. One is it is called Dermatitis Herpetiformis, or it is also called Darling's disease. Okay, now what happens in dermatitis herpetiformis is there is formation of subepidermal blisters. Subepidermal blisters. Let us see how these subepidermal blisters are formed in dermatitis herpetiformis. Dermatitis herpetiformis. Basically, you see, in these patients, when they take gluten-rich food, that means gluten is present in food. When they take food containing high amount of gluten, there results in formation of increased number of tissue transglutaminase autoantibodies. Tissue transglutaminase transglutaminase antibodies. Okay, they results in the production of tissue transglutaminase antibodies. In epidermis, there is epidermal transglutaminase. In epidermis, there is epidermal transglutaminase. The antibodies which are formed against this tissue transglutaminase will cross-react with this epidermal transglutaminase. Okay, they cross-react with epidermal transglutaminase. Due to this, there results in the formation of subepidermal blisters. But this is basic mechanism how blisters are formed in dermatitis herpetiformis. So the blisters are formed in certain locations. Sites where blisters are formed is knee, elbow, back. Okay, these are the important sites where blisters are formed. One is knee, elbow, back, and one more is buttock also. These are the sites where blisters are formed. You see, these blisters are extremely pruritic. They are extremely pruritic. Remember this. So, as these blisters they are extremely pruritic, so the patient will present with excoriative lesions. Okay, they present with excoriated lesions. So this is how blisters are formed and the characteristics of blisters. This disease, dermatitis herpetiformis, it has got association with HLA-DQ2, HLA-DQ2, HLA-B8, HLA-B8, and in this disease there are also anti-endomysial antibodies. Okay, anti-endomysial antibodies, and as I told you, there is also anti-glutaminase antibodies. Transglutaminase antibodies. Okay, so it has got association with HLA-DQ2 and HLA-B8. Remember this because this HLA-B8 association and these two has been asked in JIPMER. And one more important thing is they are extremely pruritic. This also have been asked in JIPMER in entrance exams. Okay, in entrance exam, the lesions with extremely pruritic have been asked. Okay, these things you have to remember. And then, as I told you, clinically, as they have as the lesions are extremely pruritic, they present with excoriated lesions, and the lesions are blisters are present mainly on at elbow, knee, back, and buttock. Okay, and investigations that we have to do here is mainly histology. If do is if take biopsy and do histology and see under microscope, you'll see at the papillary tip you'll see micro abscesses. Okay, this is skin, right? These are papillae, right? These are papillae. So here we'll see micro abscesses. We'll see micro abscesses at papillary tips. Micro abscesses at papillary tips. Okay, and we'll also see small collection of neutrophils here. Small collection of neutrophils will also be seen. Okay, these are investigations. Then moving to treatment. Treatment of choices. First thing that we have to avoid is gluten rich food. Gluten rich food we have to avoid. What are the foods that contains gluten? It the mnemonic, we have one mnemonic for this. One is the mnemonic is, I'll tell you in a minute. Barley, rice. Okay, barley, rice, and one more is barley, rice, and wheat. We have to avoid wheat and oat. Okay, the mnemonic is here is brown. B for barley, R for rice, W for wheat, and O for oat. Okay, this is the mnemonic. One is we can remember, we can remove this in bro. Okay, bro is the mnemonic. B for barley, R for rice, O for oat, and W for wheat. Okay, this even these also have been asked in entrance exams. And the next important, the drug that we use here is dapsone. Dapsone is the drug of choice. In almost all cases, resolves within 7 days. Okay, even but sometimes even relapses can also occur. When we decrease the gluten rich food, the antibodies will come down. Okay, when we decrease the gluten rich food, the antibodies will come down. This is something about the disease. Thank you for watching.